Hillary. Welcome to the Nurse Preceptor channel. If this is your first time finding me, I'm glad you're here. We're going to talk about corneal abrasions today. The reason that I am doing this video is partly because I'm still finishing up my 30 Prep this video series that I'm way behind on. And I got inspired today because I gave myself a really nice corneal abrasion. So if I look kind of bloodshot, there's a good reason. So it happened like this, yada, yada, yada. I was doing some stuff out in the yard and I poked myself right in the eye with a really like sharp sticker. It's like these things that look like palm trees. They have really sharp little blades on them. And I mean, I plunked my eye right down into one of the spikes and I recoiled immediately. I was like, oh my God, I just got my eye. It really hurts, but I think it's okay to treat at home. So let's go over some basics. Of course, I looked this up because I haven't dealt with corneal abrasions for a while. And anytime I had dealt with it as a nurse, I was a nurse in the hospital, in the ED. And, you know, we had things to deal with those kinds of issues, like equipment and medications we could use. So I went to the American Academy of Ophthalmology, and they have a really nice first aid for eye scratches, tips and preventions page that I went to. So symptoms of an eye scratch, well, for one thing, if you know that you poked yourself in the eye, that's a pretty obvious sign of an eye scratch. Frequently what you get is eye pain, a feeling that something's stuck in your eyes, or tearing. So check, and check. I feel like I have something in my eye, but it's not as bad as it was earlier today when I did this. My eye keeps watering, so I'm not crying, and it's just a little bit bloodshot because it's so irritated. They do, of course, this is an ophthalmologist website. They do recommend that you go see an ophthalmologist to get evaluated. And if you think you've really injured your eye, like you've got stuff leaking out of your eye, obviously that's a problem. Or if you have a foreign body stuck in your eye, you should probably head to the ED and have them deal with it there, unless you have an ophthalmologist who can get you in for an urgent care visit that day. I know when I poked it on, it teared right away. I was able to flush it out, which is exactly what you should do. And I didn't have anything permanently impaled in my eye, so not a big deal. I think I can handle this on my own. So what they recommend if you have scratched your eye is do rinse your eye with saline solution or clean water. Clean water hurts like crazy when you irrigate your eye with it. I would recommend saline, and luckily I had some at home. Do blink. Well, that's a given. If you poke your eye, you can't help it. You blink a lot. So that's why I'm probably blinking a lot right now. Do pull your upper eyelid over your lower lid. So since this eye hurts, I am going to just show you with this one. You want to just take your eyelid gently and just kind of pull it away, and kind of, you know, what I like to do is to kind of blink with my eyes shut. And every time you blink, it does release some lubricant into your eye, and it also helps to flush out any residual debris that might be in your eye. They recommend wearing sunglasses because you're going to be sensitive to light, and I found that out earlier when I was driving my car. Luckily, it's a very cloudy day here, so not so painful. Don't rub your eye. Yeah, I've been keeping my hands off of it. You don't want to be poking in it. You don't want to be touching it. If you do have to put drops in, wash your hands really well before you handle your eye in any way. Don't wear your contacts. If you have contacts, take them out. Put your glasses on. I don't wear contacts. Not an issue. And don't use redness relieving eye drops. Don't touch these, guys. They hurt. They hurt like crazy if you've got an irritated eye. Healing time. Luckily, it's very quick. Your cornea heals faster than your skin, so I'm thinking in a couple days I'll probably be fine. If you notice worsening reddening or worsening pain, fever, or goo coming out of your eye, obviously get yourself to the emergency room or to an ophthalmologist because you might have an infection. These can get infected. I'm just going to be really careful to keep some lubricant drops in my eyes for the next couple days. And really, luckily, we have some leftover steroid eye drops from a previous eye surgery. So I'm going to be using a drop of that probably twice a day for the next few days until my symptoms resolve. Anyway, that's what you do for a corneal abrasion. Try to keep your hands off of it, and just be forewarned, you're probably going to have a little bit of a headache. It's very common when you have an eye disturbance. If you found this to be helpful, like the video, please leave comments. If you have any comments for me, please subscribe to the channel. I'm having a lot of fun doing these videos, and I'm going to have some really fun skill videos coming up. I've got a number of them planned, okay? I will talk to y'all later. Bye.